Hello, my name is Robert Lurie, and I will be presenting research which investigates social anxiety, rejection sensitivity, and maladaptive social-evaluative beliefs. The title of this research is Rejection Sensitivity Indirectly Linked to Social Anxiety Through Maladaptive Social-Evaluative Beliefs, and it comes from the University of Arkansas Department of Psychological Science. This research was conducted by myself, an undergraduate student at the University of Arkansas, Hannah C. Hamrick, a doctoral student at the University of Arkansas, and Dr. Matt R. Judah, an assistant professor at the University of Arkansas. Social anxiety disorder is the most common anxiety disorder in the United States and has been associated with subsequent depression, reduced quality of life, and interpersonal impairment, even at subclinical levels. Rejection sensitivity, a disposition to readily expect and perceive interpersonal rejection, has previously been linked to social anxiety. However, the mechanisms that drive this association are unclear. Negative social experiences in early life are believed to increase rejection sensitivity. Cognitive models of social anxiety propose that maladaptive social-evaluative beliefs, that is, negative beliefs about the self and the threat of negative social evaluation, contribute to the onset and maintenance of social anxiety symptoms. It is possible that rejection sensitivity may shape maladaptive social beliefs, which in turn result in social anxiety. The current study examined the indirect effects of rejection sensitivity on social anxiety through maladaptive social-evaluative beliefs. A total of 162 undergraduate participants with a mean age of 18.95 years and a standard deviation of 1.24 were recruited through the University of Arkansas Research Pool. The majority of participants were white, cisgender women. Participants completed questionnaires in the lab. Measures included the Adult Rejection Sensitivity Questionnaire, Social Phobia Inventory, Self-Beliefs Related to Social Anxiety, and Patient Health Questionnaire 9. A parallel mediation analysis was conducted using bias-corrected bootstrapping to examine the indirect effects of rejection sensitivity on social anxiety through each subscale of the self-beliefs related to social anxiety measure. The subscales were high standards, conditional beliefs, and unconditional beliefs. Depression scores were included as a covariate, as social anxiety often co-occurs with depression. Higher rejection sensitivity significantly predicted higher conditional beliefs, unconditional beliefs, and high standards. In turn, higher conditional beliefs and unconditional beliefs predicted increased social anxiety, but high standards did not. The direct effect of rejection sensitivity on social anxiety was not significant. However, there was an indirect effect of rejection sensitivity on social anxiety through conditional beliefs. Indirect effects through unconditional beliefs and high standards were non-significant. These findings suggest that rejection sensitivity drives social anxiety primarily through conditional beliefs, maladaptive self-beliefs about specific social conditions. For example, if people see me anxious, they'll put me down, rather than through more general negative appraisals reflected in unconditional beliefs. For example, people think badly of me. Or excessively high standards. For example, I must get everyone's approval. Therefore, self-beliefs tied most closely to specific instances of negative social evaluation appear to contribute to the association between rejection sensitivity and social anxiety. Clinically, these findings underscore the importance of assessing cognitive affective dispositions, such as rejection sensitivity, along with the specific content of dysfunctional beliefs to inform case conceptualization and treatment planning for patients with social anxiety. Such assessments can guide cognitive behavioral interventions by identifying maladaptive self-beliefs most strongly tied to rejection sensitivity, thereby allowing clinicians to provide more targeted restructuring of negative expectations in socially threatening contexts and ultimately reducing social anxiety symptoms.